Okay, welcome back. I almost fell asleep there. Just kidding. Welcome to today's webinar on laser therapy for sleeping disorders. My name is Dr. David Kanashko. I am the medical director here at BIOFLEX Laser Therapy. We are North America's oldest and longest, I guess you might say, manufacturer of photobiomodulation therapy devices, sometimes referred to as red light therapy or cold laser therapy. And we're based in Toronto, Ontario, Canada. A little bit of housekeeping before I get started. You are free to ask questions. Just type them into the chat box and I will address those at the end of the webinar. You can also communicate with each other along the way. You can let me know where you're from. If you have a system, I tend to do two types of webinars every month. One more so for healthcare professionals. Anyone can watch these, as today is geared a little bit more towards our professional equipment. And also I do a webinar every month more for our consumer level devices, devices used by the general public at home for the benefits of red light therapy. The webinar is always recorded and then we edit it and we upload it onto our website. So if you want to watch it again or have some popcorn and watch it tonight, then that's fine. We'll just take a look for it on our website within a week or so after the broadcast date. This is a really interesting topic, and it comes up a lot because it seems that one of the side effects of laser therapy is that people get sleepy during the treatment session. And so we've noticed that for many decades. And sure enough, the research has now shown that there are benefits to photobiomodulation therapy that may help with your sleep patterns. And so I'm going to walk through that today. I'm going to talk a little bit about understanding sleeping disorders and in general, a little bit about sleep so we can all understand what's going on. And some recent research that talks about why sleep is so important. It's called the glymphatic system. Basically, it clears your brain of garbage and waste products so that you can function the next day. So I'm going to talk a little bit about that and how photobiomodulation therapy can possibly affect this system in a positive way. And then, of course, I'll talk a little bit about how you might customize or adjust the protocols to kind of mimic what the research has shown to date. And then, of course, I always have time at the end for if you have any questions, feel free to ask me, type them in the chat box, and then I'll get to those at the end of the webinar. This little quote here to get started. More than 30% of adults have reported experiencing insomnia symptoms worldwide. So it's obviously a really prevalent issue. And you may notice, depending on your age, that this seems to be more prevalent as you get older. And there's a reason for that. And I'll mention that as we go along as well. This particular quote is from, you can see the Journal of Neuropsychiatry from 2021. So sleep obviously affects every type of tissue and system in the body, from your brain, your heart, your lungs, to metabolism, your musculoskeletal system, immune function, mood, nervous system. It's critical that you have enough sleep in order for your body to recover. And despite its significance, obviously, a lot of people still struggle to attain a good quality of sleep. There's many challenges to that. I'm sure we're all aware of that. And essentially, it can be difficult to form or maintain the pathways in your brain that basically allow you to learn and create new memories, as well as making it harder to concentrate and respond quickly if you don't have proper sleep. Insomnia is the most common sleep disorder in the adult population, and it does pose a major health concern worldwide. As I mentioned, it's almost about a third of the population at any given time has difficulties with insomnia. And the prevalence, you can see there, the statistics as well. The definition of insomnia disorder, now this is from DSM-5, which is a diagnostic and statistical manual of mental disorders, typically used by psychiatrists and psychologists. You may have heard of this before. And it's defined as having difficulties initiating or maintaining sleep or unwanted early waking for at least 3 days a week for at least 3 months, despite adequate sleep opportunity. So it's not just 1 or 2 nights or just a week. We're talking over a little bit of period of time where you can say, I'm having insomnia. The sleep difficulties may also lead to clinically significant other issues and kind of affect social, occupational, educational, academic, behavioral, and other important aspects of our functioning. Chronic insomnia is associated with a range of adverse outcomes, including prolonged fatigue and cognitive impairment, mood disturbances, diminished daytime functioning. And again, these can affect the quality of your life. It's also linked to markedly reduced work productivity. I'm sure we've all been there before. Fortunately, the Maple Leafs have exited the playoffs, so we don't have to stay up late and watch them lose to the West Coast teams. Anyway, I do digress. And so there is high societal costs associated with somatic and mental disorders such as cardiovascular disease, cancer, pain, depression, and anxiety. So it's important. The brain is considered to have two distinct operative states. Essentially, the first one is where we are right now, hopefully, although you may be napping right now, I don't know. And that's the state of wakefulness, so-called daytime brain. This is a conscious mode. Essentially, we're receptive to and interactive with the environment. It is engaged fully with the generation orchestration of complex neural circuitry associated with what we call executive functions like focusing attention, being cognitively active, encoding memories, and undertaking skilled movements. Or you can just watch TV and not have any of that. The second state of sleep is the so-called nighttime brain. This is what we refer to as sort of the brain in an unconscious mode, but it can be aroused mode as well, but it's obviously far less receptive to the environment. Although the precise function of sleep still kind of remains a bit of a mystery, there's a lot of evidence that basically during our sleep phase, especially during certain parts of our sleep phase, there's something called a housekeeping function. And this is really critical and important. And that's kind of what I'm going to focus on throughout today's lecture. This function involves the disposal of metabolic debris and waste products that have accumulated in the brain during the day, essentially cleaning of the house. You can kind of relate this anecdotally, or not anecdotally, but sort of similar to if you're, say, doing a sport activity or something where your muscles are being used a lot. They're producing lactic acid, and our body has to get rid of that lactic acid, or else it builds up and causes muscle cramps, right? So we've all probably been there as well too. So it's kind of a similar process, but it's in your brain. So these waste products need to be cleared, otherwise they do become toxic. The brain undertakes this housekeeping function largely by using a flow of fluid that essentially sweeps across the spaces between the neurons or the neural cells, and it basically removes these waste products and drain them into the venous system and eventually into our lymphatic system. The brain cannot readily fulfill this housekeeping during wakefulness, while it is undertaking so many other complex, high-order executive functions involving very precise synaptic connections. So essentially, you can't do this while your neurons are active and doing the stuff that you just like listening in and kind of thinking and watching along. You can't clean out your brain during that phase. Ascending neurotransmitter systems that are active during wakefulness, so for example, noradrenaline, tend to suppress drainage and clearance of fluid within the brain. With a reduction of these neurotransmitter systems during sleep, the fluid clearance system of the brain resumes. So essentially, it's kind of blocked during the day, and then it allows for it during the sleep pattern. Now, it should be noted if you want to have a little cat naps. And by the way, when I was researching this, it's crazy, right? You look at, say, oh, are cat naps good for you? Well, like you'll see research that says, oh my God, you're going to die 6 years earlier if you have cat naps. And then you see research that shows that you'll actually be a lot smarter and brighter and cognitively better if you have cat naps. So I don't know. Anyway, I found a little cute picture of a kitten there. So, my point here is that During cat naps, generally speaking, your sleep is much lighter. It's not like deep REM sleep, and I'm going to talk about that shortly. So presumably it's not really aligned with the housekeeping function. So your cat naps during the day won't really help you process metabolic waste. So it's not really helpful in that way, but it may be helpful in other ways. Who knows? There are two main types of sleep that I'm sure you're aware of. The first type is referred to as slow wave or non-rapid eye movement, or NREM. Sleep is characterized by slow wave, high amplitude oscillations. This is reflective of a state of rest. This state of sleep can be divided into three main stages. Stage one is considered to be the transition between wakefulness and sleep. Stage two is considered light sleep, where muscle relaxation occurs, heart rate slows down, and temperature drops. State three is deep sleep, characterized by predominance of slow waveforms, as delta and theta waves. The second main type of sleep is referred to as paradoxical rapid eye movement, or REM, which we're all pretty familiar with, and is characterized by fast wave, low amplitude oscillations, referred to as the alpha and beta waves. In this type of sleep, that's where we have our dreams that occur, and the brain is just as active, if not more active, believe it or not, in the state of wakefulness. But it's not at all in the state of rest. So if you wake up and you just woke up and you have a dream, you're in this REM type of sleep. It's that deep sleep where someone, I don't know, you hear a loud noise or whatever, and you wake up and you're startled and you're like, you don't know what's going on. That's when you're in the deep sleep. In general, during 8-hour sleep period, the brain may cycle through the different types of sleep types. That's too many types, multiple times. The cycle starts first with slow wave NREM sleep, followed by REM sleep, and then back and forth, back and forth, back and forth. So you kind of alternate between the two during the night. Towards the end of the full sleep period, the periods of REM sleep generally become more intense. I don't know if you've ever noticed, I certainly have, is that you tend to remember your dreams or feel that you're dreaming when you're kind of waking up or around that time frame, and you may kind of fall back asleep and then kind of wake up. That's the REM, and you're remembering those, crazy dreams, which can be quite entertaining, right? If individuals are deprived of quality sleep, that is adequate periods of slow wave sleep, and the brain does not clear its waste products effectively, then there might be negative consequences that develop, such as generally being less attentive, right? Slower cognitive function, memory recall, and maybe issues with motor function. So it's probably not great that you don't get a good night's sleep and then have to do something that requires these kinds of tasks. So this can be really problematic, especially if it's an ongoing basis. In the case of memory, while the brain during wakefulness is optimized for encoding memories that occur during the day, the brain during sleep is optimized for consolidating those memories. So essentially storing them. Okay. The consolidation process can occur during both slow wave and REM sleep, where memories are laid down and then developed into long-term memory. Paradoxical REM sleep, or dream sleep, where these are laid down memories, appear to be stabilized. So, I mean, they're still trying to figure all this out, but that's kind of what they're thinking right now. With poor quality sleep, coupled with poor clearance of waste products, there is considerable disruption to the whole process of memory, namely the encoding, consolidation, and stabilization of long-term memories. So essentially, you'll have difficulties remembering things. So this goes back to maybe when you're in school and you're trying to, stay up late and cram everything in. Typically, that's not a good strategy. Your best bet is to just give it a rest at 10 p.m. and go to sleep and try and consolidate those memories. I never learned that personally. I tried to stay up, and maybe that's why I didn't get all A pluses. But anyway, the next part of what I want to talk about now is called the lymphatic system. So the brain has been shown to clear fluid and waste products by a series of perivascular spaces. So these are spaces in between, sort of surrounding blood vessels, and what's called astrocytic glial cells in the brain. The little diagram here shows red. Those are like arterioles, there are arteries or capillaries, and then the blue, you can imagine, are veins. And then you see there, it's kind of, I don't know if you can see it, it says astrocyte, and then they have these sort of appendages. and then they kind of connect around and form around these blood vessels. And the cerebrospinal fluid kind of flows along this space, and then the pulsations of the arteries push the cerebrospinal fluid sort of through these openings, these little channels I'm going to talk about shortly, and it eventually makes its way and collected by the venous system. This brain waste disposal network has been referred to as the glymphatic system, a combination of the terms glia or glial cell and lymphatic. Essentially, this is what it looks like in the diagrammic, in a diagram kind of way, what's going on. The cerebral spinal fluid, if you're not familiar with it, is formed in sort of the ventricles of the brain, sort of hollow chambers in your brain. And then they circulate around the brain. They form this important function of clearing metabolites out of your brain. You can sort of see here the flow that occurs as the cerebrospinal fluid flows around and eventually makes its way into lymphatic drainage in your neck and then out of your body. So looking at this a little bit more in depth, the cerebrospinal fluid passes through these perivascular spaces surrounding the arteries and then into what's called the interstitial space of the brain via something called aquaporin-4. These are water channel proteins on the vascular end of the astrocytes. I know it's a lot of terminology, but you see these little green little blobs here? They look like little channels. That's what I'm referring to. They're called aquaporins. And there's actually research to show that your aquaporins reduce their efficiency and effectiveness as you age. So that's part of the problem as we get older, like other things apparently, is that these aquaporins have a less ability to function, and this may lead to difficulties with sleeping. The flow of fluid is polarized directionally, being driven, as I mentioned earlier, by arterial pulsations, and they push the fluid out of the interstitial space and then into the perivascular space surrounding the veins. The fluid then leaves the brain via a series of lymphatic vessels within the meninges. These are very delicate, and they subsequently drain into the cervical lymph nodes. This drainage is rather rapid, and they've done some experiments to show that contrast agents introduced into the cerebrospinal fluid in the brain, they can actually be detected and cleared into the deep cervical lymph nodes within minutes. That's kind of how quickly this process is occurring. So you can imagine it's pretty efficient process. If this is occurring, throughout the night, you're clearing out of a lot of waste products. From there, the fluid and waste products are emptied ultimately, as I mentioned, into the venous system. The lymphatic flow correlates closely with the onset of slow wave brain activity, again, characteristic of NREM sleep. Conversely, lymphatic activity reduces considerably, and it almost stops essentially with a change to the faster wave patterns at the onset of wakefulness or during REM sleep. As I mentioned, there's a clear age-related decline in lymphatic activity, both fluid inflow and clearance. And again, I mentioned this probably has to do with dysfunction of these aquaporin-4. Why did they have to do the -4? Like, is there a -3? I don't know. But anyway, it's -4 water channels. They may be atrophied, and this reduces their ability to function. So what does this all mean? Good quality sleep results in an efficient clearance of fluid and waste from the brain via this lymphatic system, and ultimately it leads to a better state of overall health and well-being, including reducing the risk of developing a range of serious medical conditions, as I mentioned earlier, cardiovascular and neurodegenerative diseases. So there's a link between Alzheimer's and I think Parkinson's too, and neurodegenerative diseases and poor sleep quality. So again, this is a reason why you want to make sure you get enough sleep. Now, okay, what's the role? I mean, this is a laser therapy webinar, right? What is the role of photobiomodulation or PBMT? Again, referred to often as red light therapy or cold laser therapy. Well, photobiomodulation has been shown recently to improve the clearance of fluid and toxic substances from both the periphery, so like in the extremities and so forth, and from the brain itself. In the periphery, the photobiomodulation prompts a clearance of fluid via relaxation of lymphatic vessels. So we actually use photobiomodulation for edema or lymphedema through the same mechanism. And it may be the release of nitric oxide together with the increase in the permeability of the lymphatic endothelium. This is just a little diagram kind of showing that. The precise photobiomodulation induced mechanisms that improve fluid clearance and disposal of waste products of the sleeping brain, well, they're not really clear. This is all pretty early research, so I just want everyone to be aware of that. There are some proposed mechanisms, including breaking down protein aggregations and to simulate vasodilation, at least within the meningeal lymphatic vessels after the release of nitric oxide. That might be the contributing factor. There's some experimental animal model research that shows that photobiomodulation can reduce amyloid plaques in neurodegenerative diseases as well. So photobiomodulation may work primarily to increase the permeability of those aquaporin 4 water channels on the astrocytes, and therefore helping to increase the flow of fluid through the brain. In general, the wavelengths for photobiomodulation, there's a range of 600 to 1,000, although I'd argue that probably the best wavelengths are 630 to 660 nanometers, that's red, and near infrared, low 800s. And there's some discussion now and research showing a little bit higher wavelengths that may work by a different mechanism, especially 1064, may also be very helpful. In fact, some research has shown that photobiomodulation can actually help increase melatonin production. These wavelengths don't suppress melatonin. Okay, so longer wavelengths like these may be associated with, in fact, increased production of melatonin. Further to this point, photobiomodulation has actually been reported to induce sleeping and prolonged sleep duration in mice. So if you're a rat, this might work really well for you. But there's human research too, so relax, I'll get to that too. Now, what you don't want to do is have blue light. And I think we're all heard about this. You don't want to be sitting there staring at your phone before you go to sleep. That's a big no-no. So blue light, which is roughly 380 to 500 nanometers, by contrast, has a reverse effect and can suppress melatonin release, and prolonged nighttime exposure results in poor quality of sleep. So let's talk about some of the research. The biggest paper I want to mention here is by Paolo Cassano and other researchers. He's out of Harvard. I actually had the pleasure of meeting him and having a day meeting with him over in Boston. So I'm quite familiar with his research. And so he's a psychiatrist, and he specializes in using photobiomodulation and transcranial electromagnetic stimulation for psychiatric and other issues, including depression and sleep disorders and so forth. This particular one, they looked at using a wearable self-administered transcranial photobiomodulation for both major depressive disorder and sleep. I'm going to focus more on the sleep aspects for this. It was a randomized double-blinded sham control. They looked at 48 patients. These were all patients that had a major depressive disorder and sleeping issues. All participants were advised to receive a device-based intervention that was placed on the forehead for 20 minutes daily. They could use at different times over a period of 8 weeks. And the wavelength was 850 nanometers. We use 840 nanometers, so pretty similar. It was LEDs, again, pretty similar. And it was placed really across the forehead. And so this is the frontal cortex over the EEG sites F3, F4, and FZ. You can see here F3, F4. So if you look, this is looking down on the vertex of the skull. You can see the nose here, the bridge. So just like the upper forehead area, that general area is where they were placed. They used pulse rate of 40 hertz. They used 19% duty cycle. What's important here is the average irradiance, 18 milliwatts per centimeter squared. Just so you have an idea, our equipment, BIOFLEX, has a maximum of 20 milliwatts per centimeter squared. So you can see that it's spot on. They had a surface area of 55 centimeters squared. Our surface area ranges from 75 to 100 centimeters squared. The duration was anywhere from 20 minutes to 40 minutes. They did 1 to 2 sessions a day. It varied. And the fluence, which is the energy density, ranged from 22 to 43 joules per centimeter squared. That range is because the longer you treat, the more energy goes into the skull, right? This was kind of the results. Now, I just focused on the sleep pattern. And what they used was something called the Pittsburgh Sleep Quality Index. It's essentially a form. I think there's 20 or 30 things that the patient fills out, of all aspects of their sleep quality. And the higher the score, the worse your sleep. So you want it to be lower, indicating a better sleep profile. So the sham you can see here, week 0 to week 12, started at 11.52 and had a bit of a sham effect or placebo effect, down to 11.2, but really not statistically relevant. Then the transcranial photobiomodulation started around 11 and went down to 8. Okay, so that showed a statistically significant improvement of sleep quality. Especially, you can see here, it improved over time. Mind you, this was 8 weeks and 12 weeks in, right? The next study I want to mention is the effects of photobiomodulation on the sleep quality and quality of life of night shift nurses. And again, they used 830 nanometers, but they used a laser array, and they looked at sleep quality. They looked at 60 night shift nurses. I don't have a lot of information on this trial because I wasn't able to actually get the PDF paper. Some of them I don't have access to. But they did use 830 nanometers, and they treated the palm. So interesting enough. And it was 252 joules per centimeter squared. They looked at the changes of quality of sleep, and they used that same Pittsburgh one. They also used something called the Athens Insomnia Scale, MOS, 36 item short form health survey, and another one I didn't mention here, based on the World Health Organization. And following treatment, participants exhibited significant reductions in their global scores for sleep quality, indicating improved sleep quality. So the beneficial effects of photobiomodulation are sustained for a duration of at least 1 month. This approach offers a promising means of mitigating the adverse effects of night shifts and improving overall well-being. The palm, interesting. That would have a systemic effect. I don't understand that completely, but there you go. You can try using it on your palm as well. Last paper was entitled Brain Photobiomodulation Improves Sleep Quality in Subjective Cognitive Decline, a randomized sham-controlled study. Prefrontal cortex atrophy is associated with both sleep disruption and cognitive decline that I did mention this earlier. They suggest that transcranial photobiomodulation can enhance frontal cortex oxygen consumption, increasing frontal cortex mediated memory function. They had 58 patients, and they're divided into 2 different groups, sham and the real. All participants received either the sham or the real 6 days consecutively, while the sleep data was recorded. And again, unfortunately, I didn't have complete access to this paper, but they did conclude that after 5 days of PBM therapy, this was targeting the prefrontal cortex, that sleep efficiency and what's called NBAC cognitive performance were improved on the 5th day. So it kind of makes sense. If you have better sleep, you're going to have better cognitive performance, right? Okay, so that brings us to BIOFLEX and how you would use. By the way, I see a couple questions in the question box. Can you be so kind as to type them into the chat box? I can't access that question box. It's probably because Zoom Webinar wants me to pay an extra $1,000 a month or something. I have no idea, but anyway. So a few things here. There could be a few approaches, as you can see in the research, how photobiomodulation might be helpful. Most is around the frontal cortex, but there was one on the palm, and I read another one I didn't include for some acupuncture points as well. The most common wavelength, as I showed you, it tends to be in the 800s, 20, 30, 40, 50, like around there. So that would be the one I would recommend. If you're using our professional grade equipment, it's pretty easy to do this. You would use the dual plus array near infrared. That's 840 nanometers. At 100% power, continuous wave, it's 20 milliwatts per centimeter squared. Surface area is 100 square centimeter. If you have a dual 180, same power density, just 75 square centimeter. Most have the 240. So the recommended pulse rate frequency, I know Paulo and his researchers and other researchers have talked a lot about using 40 hertz or even 10 hertz, but I think 40 hertz seems to be the way to go, or maybe even just continuous wave could be effective. So essentially what you would do if you have the professional equipment is you could set the array at 90% duty cycle. That gives you 18 milliwatts per centimeter squared, pulse rate at 40 hertz. And that would give you that roughly 21.6 energy density for 20 minutes treatment time. Doing the math there, I did it for you, so you didn't have to, ramp your calculator out. Again, I kind of recommend the 40 hertz, but I don't know, you can try other ones as well. You may have to sort of customize your treatment. You don't have a protocol for this. So essentially, when you customize, I don't think you can put in 0 seconds for the red. At least I don't think you can, but if you can, put 0. Otherwise, just put in red continuous wave 1 second. So it will give a short, brief 1 second of red light. Then you're going to do a continuous, or sorry, you're going to do a modulated square waveform, 90% duty cycle and 40 cycles per second or 40 hertz. And the treatment time is, around 20 minutes or so. So if you're looking at where to apply it, I mean, it's pretty straightforward. It's across the forehead. You can see the EEG points. Try and get up to top of the hairline if possible. And applying it like that, the patient can probably best is just to lie on their back and gently place the array over it, so you don't need to strap it into position or whatever. It tends to be a little bit heavier. If you have the silicone one, you can kind of maybe gently strap that on because it needs to be kind of folded to touch the skin. But essentially, that's kind of the area that you want to target, and you want to try to cover those EEG points, but especially the frontal cortex, prefrontal cortex. If you have the mini port home system or the P120 or the P180, you can't customize these ones. But the similar dosage you might obtain would be level 1 HIP. That's roughly 12 minutes of the infrared step. So what I suggest is that, level 1, choose the HIP protocol, turn it on, let the red light, do its thing, treat somewhere else, or it doesn't matter. And then when it stops and then turns onto the infrared, that's when you would place it over the forehead. And that gives you roughly 12 minutes of infrared. I mean, yeah, you can try and add an extra few minutes if you want, but even I think at 12 minutes, you'd get good benefit. The timing of when to do this varies. Anecdotally, I watched Michael Hamlin. Michael Hamlin, by the way, he's now retired, but he's considered one of the premier, preeminent scientists in photobomb modulation. And he just was off the cuff talking about how he puts it on his forehead an hour or so before going to sleep, just using infrared. And it feels that it's very helpful. Some of the research does it during the day. You may have to experiment that. I think you'd have benefits at any given time, but maybe leading up to sleep might be the best time to do it, but we don't really know. So you can kind of play around with that. For the most part, I would say do it daily. And then as you're getting good benefit from it, then you could probably treat less, maybe, 2-3 times a week or what have you. Some of the research showed that the benefits do last quite a while. So you can maybe even take a break, but, you probably want to sort of do it on an ongoing basis. Before I get to your questions, I want everyone to know that, especially if you're a healthcare professional or you're interested in laser therapy, I'm doing 2 Two events in September. I think it's 13th and 14th in Toronto. I have to pick out a venue. And one is called Light Up Your Practice, which is basically if you're new to photobiomodulation and you're interested in learning a bit more about it. I'm doing a day event. I'm also will be probably doing this with V-Light. V-Light is a device manufacturer that specializes in photobiomodulation for neurodegenerative diseases and cognitive function and that kind of thing. It's like a wearable thing around your skull. So they'll also be there as well. And on the Sunday, I'll be doing a 4-hour session on treating post-concussion syndrome and advanced certification. This should be broadcast live, so you can also sign up for it and watch it live. You don't have to come to Toronto, but if you're in the GTA, it might be a good opportunity to come in and check that out as well. Okay, let me get to your questions. Oh, hello, Elma from Pretoria, South Africa. You guys have been in the news a little bit. Did you hear what our friendly US president, not my US president, had to say about South Africa? Oh, goodness. All right. Okay. I won't get political because I shouldn't do that. Is hair treatment with laser therapy useful for sleep? I would say no, because hair treatment, you're going to use red light. REM sleep, dream, NREM sleep, deep state. So with light therapy, would that increase REM or non-REM? So again, I don't think it increases either of those. I think the mechanism revolves around increasing the efficiency of your lymphatic system in the brain to clear the metabolites. I think that's kind of how they think it would work. And again, I answered how you would do the P180 and when to apply it. Like I would say an hour or two before sleep. Does light go through the skull? To some degree, it does. Yeah, and not a lot, but some does. The near infrared, especially. The skull, like it absorbs, but like bone is actually relatively porous. Like light can get through bone. Of course, you're not going to get all that light into it, but neurons are extremely sensitive. It doesn't need a lot of light to be activated. That's the benefit of treating the brain. So, question, can this replace taking prescribed sleep pills? Hey, look, this is not medical advice. This is just showing you what some research suggests, and it may be helpful. I'm not about to say don't take your pills or whatever, but the evidence is showing that it may be a helpful strategy, and if that strategy helps you to take less prescribed medication, to be honest, that would be a bonus, but I wouldn't say that's what I want you to do because I'm not your treating clinician. What does it mean if you never dream? You know what? That's a good question. It's probably just because you're not waking up during your REM cycle. That's what I would guess, but I'm not a sleep expert. What are the settings for the dual ray? I answered that. You said placement is the upper forehead. Yep. So I already answered all those questions. What about 240 or 180 arrays? So again, I said you can use a 240 to 180. Same thing. Doesn't really matter. You just cover a bit more area at the 240, but the 180 would be fine as well. Uh, Sorry, Sherry, you mentioned about being available to assist with settings. I'm not really sure what you mean there. You might want to email me there. Can you quickly go over the array settings again with red and infrared? Do we use probe? So no laser probe, red, continuous wave, 0 seconds. If that doesn't work, 1 second. Near infrared, 20 minutes, 90% duty cycle, 40 cycles per second. Okay, I've answered a lot of these already because I'm saying just use the infrared. What other protocol should be for the professional BIOFLEX? That's what I just did. That's the professional one. Could you use, so the professional one is the dual array, right? So I just said that. By the way, this will be on our website, so you can reference it later on, should you need to. Is there any concern if you place the array on the forehead with the red light on? No, there's no concern. I just don't think the red light's going to do a lot, to be honest. But you can do that if you want. I don't know how to input into my system. I'm not a clinician. Okay. So Sherry, if you have a professional system, like I'm not sure what system you have, Sherry, so you're gonna have to email me. I've got to sort that out. But if you have a home system like a P180 or P120 or a mini port home, you can't customize these protocols. When we have a dual ray, you should be able to customize it. Okay, so Sherry, email me and we'll sort this out later for sure. Listen, thank you everyone for joining me today. I really appreciate it. Hopefully we'll see you out in September. I will be putting up a series of new webinars coming up shortly. I have some travel coming up as well. So as we enter the summer months, I may not be doing as many webinars, but I appreciate you tuning in. Take care, everyone.